Hey guys, so today we're going to go over chapter 3, which kind of encompasses a lot. So buckle up, pay attention, and hopefully we'll get through this. Okay, so you will have both of these references that I'm going to go back and forth to, you have access to. So the first, and I'm going to present so you can see my screen, is sorry, sorry guys, I had someone coming to talk to me, of course, right as I start this video. Okay, so you should be able to see my NHA, this chapter 3. So this is what yours looks like when you go and you want to go into a module. You should have been able to work through module 1. So this is actually module 3. We're skipping to module 3. Which is medications, classifications, routes of administration, all of those things, which don't sound familiar right now, but they will soon. So we're going to watch this first. I forget what this is about, but it's in the very beginning of my PowerPoint. So I'm going to go ahead and play it, and hopefully y'all can hear it. And maybe it won't play. I don't know. Okay, here we go. I think it's pretty short. Let's see if I refresh it, if it'll work. And it's wanting to freeze up on me. Okay, so we'll just go back to the PowerPoint. Okay, I'm going to, sorry this is taking so long, you guys. This is just like real life. Okay, view, no, it's slideshow. Play from start. Okay, so this is going to be the highlights of chapter 3. So the first thing we're going to talk about is medication classifications. So we talked a little bit about this in the Google Meet, and someone had asked the question of what's the difference between the scheduled drugs and that schedule 1 through 5 and the classifications. There's a little bit of a difference there. So I'm just going to break it down for you real quick. Medication classifications are basically every medication has a classification. So whether it is a narcotic drug or not. So last week we were talking about DEA numbers, narcotics, and scheduled drugs, which are basically drugs that are regulated by the DEA. Okay, but remember, not all of them are. So all drugs, even Tylenol, even ibuprofen, stuff you find over the counter, cold medicine, all of that stuff, all of it has a classification. So for example, ibuprofen or Advil or Motrin, those Motrin and Advil are the brand names, but ibuprofen is the generic name. Its medication class is an NSAID, so a non-steroidal anti-inflammatory drug, or an NSAID. So that's its classification, okay? So all drugs have classifications. Now, narcotics have a subclass. They've got their own thing. They're not only called narcotics. So for this example here, it says hydrocodone, Vicodin, classification opioid, narcotic pain reliever. So that would be its medication class, but then it's a scheduled drug. So that means it's regulated, right? Because any narcotic is a scheduled drug. It's going to be regulated on that scale of 1 to 5. Remember, 1 is illegal, so nobody can uh, can be prescribed a Schedule 1. A Schedule 2 is what hydrocodone is actually. So it's a scheduled drug, and it's a Schedule 2. You've got 3, 4, and 5. So all of those are for scheduled drugs only. So something like an NSAID, like ibuprofen, is not scheduled. It would not have a schedule, but it has a classification. Does that make sense? All drugs have classifications. Only some of them are on that 1 through 5 scheduled drug list, and you will need to know those eventually. Okay, so this was the video that wasn't showing up on my screen, but maybe it will on yours. So if you want to, you're going to have to go through module 3 on NHA anyway, so just make sure to watch these videos. Okay. Sometimes they're classified under the body system they treat, but sometimes, most of the time, it's function or therapeutic effect. For example, the therapeutic effect of Vicodin is a pain reliever. So that's it. That's what it's a narcotic pain reliever is the medication class. But sometimes it's under the system they treat, but mostly not. There's a few exceptions. For example, you could classify diphenhydramine under respiratory, but most of the time, if you Google it, it's going to come up a specific classification. Like a diphenhydramine would actually be an antihistamine. So the antihistamine would be the classification. But many drugs can treat different body systems. So, for example, Lasix or furosemide is a diuretic, so that's its drug class, and it treats cardiovascular diseases, but works to excrete more urine. Therefore, it works in the urinary system too. So it can work for multiple systems, and that's why most of the time it is actually classified under what it does, like diuretic, which actually basically what a diuretic is it takes excess fluid out of the body. So because it can treat different systems, they usually say, well, we might as well just do it under what exactly it does, and classify it under what it does because it could treat a bunch of different things because the body's all connected. There are some sub-classifications. Anti-neoplastic drugs are basically chemotherapy drugs. Anti-neoplastic means anti-cancer. Okay, so you need to know that. Anti-neoplastic means anti-cancer. And then the sub-classification could be cytotoxic drugs, which kill cells. And there's another subclass, alkylating agents, which block cell division. So they do 2 different things. So most of the time, you've probably known someone that's had chemotherapy, but you don't know exactly what it does. So there's 2 main sub-classifications of chemotherapy drugs. You've got the cytotoxic ones, and you've got the alkylating ones. And so it depends on what the cancer is for what drug they'll give, but all of these drugs are anti-neoplastic, but they can be broken down even into smaller subcategories. Okay, I don't think they want you to know that on the main test. I think they just want you to know some examples of anti-neoplastic drugs, but they did mention this in the book, so I thought I would bring it up as well. It's on page 42. Some common classification examples. I don't know if it shows. Let me see if it shows on here. Oh, you're supposed to, I had y'all look them up. So you know what I'll have y'all do is, so right now you can pause this video and write these down or type them in, and I want you to look them up online. And I'm going to have you guys upload this as like your part of your assignment for today. Okay. There's not that many, but I want you to look them up. I'll give you an example. When you put in amoxil on Google, I'll just like Google it myself. Amoxil. The first thing that comes up, it says amoxicillin, brand name amoxil. So Amoxicillin is the actual generic drug name. So brand name is Amoxil. And the classification is a penicillin antibiotic. Okay. And that's its drug classification. And they give you some other information too. It says drug class penicillinase sensitive penicillin, but I just want you to know the basic one. And at the very top of the page, it says penicillin antibiotic. That's really what I want you to know. And it treats infection in stomach ulcers. That's what it does. You're going to have to know like all of these. So these are very common ones. So look those up. And yeah, that will be your part of your assignment for today. Okay, so dosage forms. Now we're going to switch over. We talked about drug classifications. Now we're going to talk about dosage forms. So dosage forms are the various formulations in which medications are available. So you've got semi-solids, solids, semi-solids, and solutions. So solids could be capsules or tablets. Semi-solids could be creams, suppositories, ointments, emulsions, and pastes. And then solutions would be elixirs, syrups, spirits, suspensions, tinctures, extractives, and colloidians. And y'all are going to go through what all of this is soon in a group work here. Others, patches, sprays, inhalants, implants, and gums. So let me just break this down even easier. So basically, every time you ingest a drug, sometimes it's going to go through your stomach and go through as a pill of some kind, so capsule, tablet, and that's going to be a solid. Others could be semi-solid, so a cream that goes on your skin. So say you get a skin rash and you get a cream, it's going to be a semi-solid. Suppository is kind of, we actually practice making these in my class, so hopefully I have y'all next semester we can make them, but those go into your anus or your vagina, depending on what it's for, and they melt, okay? So they're not completely solid. Ointments, same kind of thing, goes on top of your skin. Emulsions and pastes, they're just a little thicker, so they're not a complete solution. Emulsions are closer to a solution, but it has an oil in it and makes it a little thicker. Then solutions, as you probably know through, just the thought of what a solution is, it's a liquid. So a full-on liquid. Elixir is going to have some kind of alcohol in it. A syrup is going to have some kind of a sugar in it, sugar base. So don't forget, like maple syrup. I think that's how I have people remember that. It's going to be a sugary substance. Spirits also have a alcohol component to it. You'll see elixirs and spirits in things like, what's it called? Like NyQuil, where they have an alcohol base. Suspensions are a drug that is not completely dissolved. So you'll have some like crunchy particles at the bottom. So you always have to shake suspensions. And that's one question that they'll ask you is like, what do you need to know the most about suspensions? And it'd be shake well, is like, it's always going to have a label on there that says shake well. Tinctures are kind of similar to elixirs and spirits. Extractives, those are things like, if you think of like it's going to be a very potent liquid. So kind of like vanilla extract, you only use a little tiny bit. And so sometimes they'll put extractives, they'll like take a little bit, like a teaspoon out and add it to water because you don't need that much. Or you could just put like one drop on your tongue or something like that. And then colloidians. Colloidians, I want to say those are similar to suspensions. They are, I'm going to look it up real quick and see what it doesn't even have the colloidians pharmacy. I was looking up the definition of them and it's like not even coming up. I think it was in the book and I was like, oh, I haven't seen this anywhere else. And I'm pretty sure it's similar to the elixirs, spirits, tinctures type of thing. Okay, and then others, you've got patches, if you've ever heard of like, a anti-smoking patch, or a what is it called? A birth control patch. They have patches that are birth control that you put on. They're not super common, but they are still out there. Sprays, you could have something like a spray that you spray into the back of your mouth. Something like a what is that called? Like chloroseptic. You spray that in your mouth, and it's supposed to numb you at the back of your throat if you have like sore throat or something like that. Inhalants and aerosols, those are going to be like your inhalers. If you have asthma, something like that, that's a very common inhalant that you're going to inhale into your lungs. Implants, these are things that go in your skin. Like birth control implants are a big thing. They go under your skin. It's like the size of a grain of rice, and it's supposed to work for a few years. And I think Implanon, which is it goes into your uterus. It's a IUD, is also considered an implant. And then gums. So a lot of gums out there are for things like anti-smoking gums and stuff like that, nicotine gum. So those are examples of all of those, okay? And then you've got the route of administration. So that is how it goes through the body, okay? So parenteral versus enteral. So there's two major categories. Parenteral is outside of the digestive tract or the gastrointestinal tract. So it could go through skin or mucous membranes, like vaginal or topical, like on your skin, or it's going to go in most often as an injection. Okay, so when you hear parenteral, most often they're talking about an injection, but it could be vaginal or topical, or anally also. Well, no, not anally, because that actually is in the intestinal tract. So no, that would be enteral. It doesn't go through the digestive tract, but it does go into it, if that makes sense. If it goes orally, it's going to go down, like say you take a pill, goes down your throat, into your stomach. It's going to go through your intestinal tract and out your anus eventually, right? Along with probably through your liver and all of your organs and your urinary system and all that. But that's what they're talking about, is it's going to go through that digestive tract first. Except for the anus, that's kind of its own thing. It is part of the digestive tract, so they still call it enteral. So those are the main ways that they can go through your body, right? Here is a picture of parenteral routes of administration. ROA means route of administration. So that's going through, intravenous is going through straight into your vein. Intradermal just goes into the epidermis. Intramuscular goes straight to the muscle, and subcutaneous goes right under your into your fat. All right. They talk about immunizations in this one, and this is also in Module 3. And then they talk about medication side effects. So how people will come in and have some medication side effects and how they'll talk to the pharmacist about that. OTC versus BTC, we've already talked about this, but it's just a review. OTC is over the counter, doesn't require a prescription. In Chapter 3, it does give you a list of the top 40 OTCs, so you do need to know those. And then BTC is behind the counter. That is usually something with ephedrine or pseudoephedrine, like Sudafed. And why is it behind the counter? Because it can be used to make meth. And there are strict regulations. Remember, you can buy 3.6 grams per day or 9 grams per month. 9 grams is the total per month you can buy total, but you can only buy 3.6 per day until you get to that 9 for the whole month. Okay, drug names. I talked a little bit about this a few slides ago. Generic, and I've talked about this before, but it's basically generic. Every drug has a generic name or a non-proprietary name, which the manufacturer gave it to identify its active ingredients. Then you've got a chemical name, which identifies chemical structures. Normally, you don't need to know that. And then the brand name is going to be the proprietary name given by different manufacturers. So once a patent runs out, I think it's 20 years. Every year I have to look this up, but I'm pretty sure it's 20 years, which is a long time. The patent will wear off on a drug. And then there can be generics that come in and sell it at a cheaper price at a generic. It's equivalent, but it is a generic, so it's cheaper. And you'll see generics all over the place. For example, Motrin and Advil. Motrin and Advil are the brand names for ibuprofen. Ibuprofen is a generic name. Okay? Can you think of any other ones? Think of another one. Can you think of any other ones? Another one would be acetaminophen or Tylenol. So Tylenol is the brand name, but the generic would be acetaminophen. Okay, generic. Why is there a difference between generic and brand name? Well, most likely patients will want generics because they save money. They're way cheaper, and generics help keep prescription prices competitive. Prescription insurance programs sometimes will only cover a certain thing. Like sometimes they'll only cover brand names, sometimes they'll only cover generics. So it depends on, what the patient wants to pay for. Generics save money overall, and help patients to obtain prescriptions they could not afford otherwise. And they are generically, generics are equivalent in potency and bioavailability. They are completely the same as a brand name, and they have to prove that to be on the market. Side effects are usually not life-threatening, but sometimes can be beneficial. For example, diphenhydramine or Benadryl is the brand name, is an antihistamine, but a side effect is it can cause drowsiness, which can be good or bad depending on what you want. Like if you wanted a sleep aid to help you sleep and you were having some problems with, allergies or something, you could take diphenhydramine and the side effect might actually work for you and help you sleep. So sometimes side effects are good. Most of the time they're kind of annoying, but it depends. And then contraindications and medication interactions. When two drugs interact with each other, creating a specific effect. So sometimes drugs interact with each other so they can make them absorb more or make them absorb less. For example, Tagamet and metformin, when they are taken together, it increases the absorption of the other. Sometimes that can be good, sometimes that can be bad because it may make it work more than it should. Contraindications for specific medications are diseases, disorders, or conditions that can make it unsafe or potentially harmful for patients to take those medications. For example, a pulmonary edema or excessive fluid in the lungs and bradycardia or slow heart rate are contraindications for taking atenolol or Tenormin, a medication that treats hypertension. So if you have these issues, you would not want to take Tenormin, right? Another example is pregnancy and Accutane. So Accutane is a really potent medication to treat acne, like really bad cystic acne. But when you're on it, you have to actually, if you're a woman, you have to take 2 forms of birth control or use 2 forms of birth control in order to be prescribed it. So because it can cause really bad birth defects. Birth defects, yeah. So that's pregnancy is contraindicated for taking Accutane. Okay, in this chapter, they kind of throw in compounding. I think it's kind of random, but compounding is the preparation, mixing, assembling, packaging, and labeling of medications or medication devices, including raw ingredients to formulate a medication product. And it can be sterile or non-sterile depending on the route of administration of the drug. So we'll be talking a lot more about compounding, but compounding is basically, you don't really do it in the community pharmacy like a Walgreens or a CVS, but if you worked at a hospital, they pretty much compound everything all the time. Or if you work at a compounding pharmacy, they will compound as well, and they have to have a sterile room where it's completely sterile, and they will make the drug in there. The important thing about sterile versus non-sterile is that if you are giving a medication through the skin parenterally, so in some kind of injection, you have to have it completely sterile, because what can happen is if you don't make that medication sterile, and a bacteria gets in or virus gets in, that patient is going to get that straight to their vein, a bacteria or a virus straight to their vein, and they could go septic and die like within 24 hours. It's very bad. It's not that rare either. But that's why they are so serious about compounding medications sterilely. And when they make IV bags or shots of any kind, they have to make them in a sterile environment. So those are important things to know about that. When compounding goes wrong, these are some signs you may see: discoloration, separation, uncharacteristic odor, texture changes, visibility, contaminants, and precipitation. So this is like if you compound something, supposedly you're supposed to be able to look at it and tell if it didn't compound right. But I feel like you would have to have compounded for a while to be able to like know if this is, wrong or whatever. So, but they want you to know these are chemical or physical incompatibilities. And then some factors for affecting stability of medications: pH, temperature, light, concentration or dilution, and filter or plastic materials. So always check manufacturer's recommendation warnings about incompatibilities. This is basically just stating that, and I've told y'all this before about the amber colored bottles that medications come in, because medications can be affected by light. They can be affected by pH, even, being in plastic. Sometimes you can't put certain medications in plastic because it'll mess them up. So it just depends on the medication. You always have to check the manufacturer. If you're creating a medication, if you're compounding one, you have to look at it and see what it makes you put it in. And that's even with the regular pharmacy too, because some pills can't be put in certain containers. And then vaccines, a quick overview: know that pharmacists can give them. Active immunity: when the immune system produces antigens by being exposed to that pathogen, usually in dead form in vaccine. Most common is the flu. And what does a vaccine do? It prompts the immune system to produce antigens that target a specific pathogen. Final words: know the drugs in this chapter. We're going to have to learn them. It's a lot, you guys. So I'm going to stop presenting here, but we will go through them as we go through chapter 3. And in fact, I may not have you work on them now until the first of the year when we start the top 200 drugs. So stay tuned for that. You will need to know these. You could start looking over them if you wanted to, but mainly know about those basic things in this PowerPoint. Okay, guys, I hope you learned a lot about this. I want you to go through Module 3. Make sure to watch the videos if it works for you, if it shows. I don't know if it will, but it's going to help kind of solidify all of this information because it's really important. Okay, bye, guys.